Okay, so let's go over the AD log one by one so you understand what you're going to be initialing. Okay, on the first part it says status indicator shows a green light or okay battery function. So what that means is this part right here, when you look, there you see a little window. Okay, that means that when you look through that little window, you'll see a green flashing light. That means that the battery is working, that the AED is working. What I like to do is I don't really focus on that green light. What I do is I like to open the Velcro, and then right here where that green button is, that's the on button. I'm going to push that button and make sure that the AED talks to me. Okay, you can do either or. Okay, then you're going to initial under the month that it falls on. Okay, the next one is storage unit cabinet intact and clean. Okay, that's talking about this white box is the storage unit intact and clean. So you're going to initial and you're going to put okay. AED exterior intact and clean. That's the actual AED, is the red part. Okay, intact and clean. It's not ripped, it's not destroyed, it's intact and clean. User guide available. Remember the little booklet that I talked about? Is that user guide in there? You're going to initial. Life Pack 500 adult pads, 2 sealed, undamaged, in date. Okay, that's these pads right here. Are they sealed, undamaged, in date? You're going to focus on your expiration date. You're going to initial. Okay, the next one, it says 1 sealed, the other one in plastic case and plugged in the AED. Both should be undamaged, in date. It's asking you again. You should have one that's sealed, one that's packaged. Okay, both undamaged, in date. Okay. 1 set of sealed, undamaged, in date PD pads, only for location with this type of pad. Okay, if you see, I drew a line through this. I don't want anybody initialing in there because we do not have PD pads. We have 2 set of adult pads. Okay, the next one is 1 PD key, only applies to hard start AEDs. So there you go, you're an initial there because we do have that PD key. This is the PD key that I was talking about. Okay, the next one is zipper kit. You should have zipper kit, which this is a zipper kit. Some of you have a black zipper kit. It's attached to the AED on the outside. What does it have? It should have a mouth barrier device, scissors, non-latex gloves, and hand towel. Okay, if you do not have a hand towel, which most of them don't, it's okay. Just put a couple of paper towels in there. What is that used for? That's used for to wipe off the chest in case the patient or the student is sweating, or the teacher is sweating and you need to wipe that sweat off, or if they were in the pool and they were wet for some reason, you're going to wipe that off so you can stick those pads on. Okay, also something that you will find in there that is not listed on here is razors. It's okay to have razors. What that's for is to shave off a hairy chest, because when you have those pads won't stick on hair. It's very hard for it to stick if there's too much hair, so you can shave. Students are really not going to have that, but maybe the high school students, but usually the teachers, if you ever have to use it on a teacher. Okay, I usually like to also put this one in a clear sheet. Why? Because it's the only one you're going to use for the year. By the end of the year, you don't want it to get all raggedy. So if you put it in a clear sheet, I like to tape it by the AED. So let's say the AED is right here. Okay, I like to tape it right underneath. Okay, so I know that the cover nurse will see it and will check it off. Okay, so those are the 2 things that you really have to check when you first come in, is your refrigerator, log in your refrigerator log, and then you have your AED and your AED log. Okay, a couple of supplies that you will need just to get started for your day, regardless if it's your clinic or you're covering for that clinic, is this book is very, very helpful. It's called Emergency Guidelines for Schools. So we all know what to do as nurses, right? We went to school, but what does the school board require of us? if you're a new clinic nurse and you're not sure what to do when that student comes in, this is a great book, a great resource for you to just flip, look for it. It has tabs and it'll say allergic reaction, asthma, wheezing. It's very straightforward. Let me show you one just so you can see. I like to do blisters. It's very straightforward. So this one is blisters, okay? It says, wear disposable gloves when exposed to blood and other body fluids. Wash the area gently with water. Use soap if necessary to remove dirt, okay? Is blister broken? Yes. Apply clean dressing and bandage to prevent further rubbing. Is blister broken? No. Do not break the blister. Blisters heal best when kept clean and dry, okay? If you do, if it's broken, it tells you. If infection suspected, contact responsible school authority and parent or legal guardian. So it's very, very straightforward. This is a very good tool to have. So make sure you locate this in the beginning of the year, or if you'd like to use it. If you have a student, one student with a condition, and you look that one condition up, I promise you're going to remember the next time you have that student with the same condition. So you won't have to look it up every single time. That's one thing. The other thing that you need to locate in your clinic is a master copy binder. Okay, it's not going to have this sheet, okay? The master copy binder is just a binder with your blank copies in it, okay? I have all my blank copies in a clear sheet. That's how I like. You have it however you like. Every clinic should have it. It's gonna help you to find your care plans, okay, your med authorization forms that you're gonna be giving to your parents. Anything that you need to make copies, you just go to that binder and you find them. I like to put tabs on it so it'll be easier to flip, and I'm not flipping through each page to find what I need. Okay, so that's pretty much it. That's the first couple of things you need to do when you first go into a clinic.